Okay, we are live with our very first Healed Gestational Diabetes Masterclass. I am Joanne Fisher of Conscious Birth and Wellness. And can I get my slides to move on me? No. Little techno difficulties here. Why can't I progress my slides? Okay, I guess I'm doing it from the screen. So I'm Joanne Fisher. I am a holistic birth consultant, aka a body talk birth keeper. I'm a doula and birth educator. I'm a certified body talk practitioner, and I have been since 2014, almost 10 years now. I'm a certified infant sleep educator. I've been an infant sleep educator since 2017, with my first training and my second training in 2019. I have been a yoga teacher since 2006 and a pre and postnatal and fertility yoga teacher since 2011. So I've been working with expectant families since 2011. I am an exercise specialist and was a personal trainer for many years, as I did a bachelor's degree in kinesiology and exercise science. And I am currently studying and taking certification in cognitive behavior therapy. But my delving into the birth world goes a lot deeper than that. I have been a member of the Pre and Perinatal Psychology and Health Association, APA, and I presented at their 2019 World Conference on talking to babies in the womb. That's all our birth psychology and fetal consciousness and all the science of that. I've taken trainings, in-person trainings with spinning babies and the work with fetal positioning. I've taken live trainings with Dr. Shafali and other courses with Dr. Shafali in conscious parenting and many, many, many parenting summits. I've taken courses with evidence-based birth and have access to all of their resources. I've taken a class with indie birth and intentional birth, and currently in studies with Good Birth Co's trauma prevention and client advocacy training. And I've taken training in also in pregnancy loss support with the Institute of Birth, Breath, and Death. On top of many other things I have studied over the years. I am the author of a new ebook coming soon, The Pregnancy Symptoms Translator. It's the body consciousness guide to a pain-free pregnancy and an easier birth. And so it really dives into what it is that we are covering today. And what happened? We lost my slides. I lost my tab altogether. Weird. What's it? Um, find. Sorry, guys. We're getting some fun difficulties with tech today. Find the right account. Find my slides as they disappeared altogether from my browser. And the other account. There they are. Okay. Lovely technology. I'm getting used to using Google Meet. It usually works a lot slicker than Zoom, and it's just easier to get everybody in and out usually. So here, let's share tab. And hopefully we won't lose them again. All right. So, as I was saying with the book, we're going to get into a lot of what's in that book as how our body is communicating with its symptoms in tonight's class. So, nothing is to be feared, is only to be understood. Now is the time to understand more so that we may fear less. I love, 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 love this quote. Fear and faith are on a spectrum, they're on opposite sides of the coin. If you are in absolute faith and trust, you can't be in fear. They just can't exist with each other. They're on the opposite sides of each other. And so my big passion, my big goal is to get you into a place where you're in absolute trust and faith in your ability to heal yourself, to birth your babies, to take control of your birth, be the advocate for yourself, to trust your intuition, everything that you need to be the parent that you want to be in this lifetime. So we got to get out of the fear. And that's what BiTalk is really about. You can have a healthy, easy pregnancy, a painless or even orgasmic birth when you listen to and acknowledge the messages from your body and from your baby. And I had my first birth, wasn't a BiTalk birth. I'd had one session in the early pregnancy. It was my very first exposure to it. I didn't do anything more. And I found BiTalk when my oldest was 2. And so my second baby was a BiTalk baby, and the whole way through, and his pregnancy was so easy. His birth was so fast, and it's like the easiest birth ever. Whereas my first birth, I actually had an orgasm, a flooding orgasm that made my doulas think my water broke and called the midwife in, woke my husband up. And it was quite the interesting thing so this is my place of being in absolute faith. I had found out about the concept of orgasmic birth through doulas in my community, and I read the book, I watched the movie, and I just set the mindset, and I had this absolute trust and knowingness that I was to have an orgasmic birth with my first. And I got it. And so it's that place of absolute knowingness and trust that I help you guys to find within yourselves. I'm not a doctor, I'm a translator. BiTalk is working to translate the symptoms so that your innate ability to heal itself can get to work. So we'll get into that a fair bit more. The doctor resides within you. So BiTalk therapy helps you to heal your body, your stress, your trauma, your fear, your anxiety, that your pain's communication. It helps you to connect with your baby, helps you to feel empowered and supported. So when we look at our soul's journey, that we're here in this lifetime for a reason, and we're going to get what we get. And we're not always in control of the experiences. They're going to show up as they need. And we can choose to allow our experiences to hold us back and to not allow us to become great or achieve greatness in this life, or we can allow our experiences to push us forward, make us grateful for every day we have, and to be all the more thankful for those who are around us. And so if you've had a diagnosis of gestational diabetes, that experience, you can either use it to empower you to take strides forward and take control of your health and your body, or you can let it overtake you. So every journey we have has its own impact on us. So my story is I was an unwanted conception. My mom wanted to leave my dad. My siblings are 5 and 7 years older than me. And when she found out she was pregnant with me, she was devastated. She, as we've talked about this now as an adult, she framed it as I added more years to her sentence. And so I talk about the 4 baskets and how our earliest stories, our conception, our time in the womb, our birth, and our first 6 hours of life set the foundation for who we are and how we fit into this world. And I was an inconvenience. I was unwanted. I never felt like I had a place in this world until I started doing this healing work, and it changed my life. And if I wouldn't have had that experience of being a traumatized baby in the womb who was unwanted and disconnected from my mother, And I've done hypnosis regression work, and I was able to experience the moments after birth that, she loved me, she breastfed me, she connected with me, she did the best she could given her own experiences. And I turned out, quite okay. But there's been a lot of healing work to do because of that time in the womb and the disconnect and the resentment she carried for me. And because I was traumatized in the womb, it makes it my passion, my purpose to work with babies in the womb, to make sure they're seen, they're heard, they're acknowledged, that they don't wait 30 years of their life to heal their stuff like I did. So, conscious birth is working to understand the communication of labor and birth, to bring conscious awareness to the underlying stories behind any pain, challenges, or complications. Preparation for both baby and birthing person, helping you to be ready, excited, and empowered for birth, even if you're a planned C-section. You guys both ready, excited, we can help with the process leading up to it, all while keeping in mind the bigger picture of our soul's journey and personal evolution. And so we may have ideas of what our birth is supposed to be, but your soul or baby's soul may not agree with that. And you're going to get what you're going to get. But we can plan and change, and we can work at letting go of our expectations and our mindset while planning to really empower ourselves and create the best experiences we can while still being flexible for whatever your soul wants to give you. So I just threw in this little quote here from Michael Odent. Gestational diabetes is a typical example of a term with a strong nocebo effect. So you've heard of placebos and how you're given something, you're told it's going to heal you, it will heal you. A nocebo is the opposite. It has the power to transform a happy pregnant woman into an anxious, depressed one. On the side effects of the term gestational diabetes, or one of the side effects of the term gestational diabetes, is to transform the interpretation of the results of a test into a disease. The status of disease implies that complications have been identified. It is commonplace to claim that macrosomnia, a big baby, is the main complication. This should be considered an association. The use of enlarged criteria to interpret the test is one of the reasons why the number of women diagnosed with gestational diabetes is increasing. And so you have taken a test, but there is actually no disease that may have been identified within you. It's interesting, right? That the biggest risk is a big baby. And there's lots of data around big babies from evidence-based birth and stuff we can look at. And the guidebook, I will include lots of links and resources for you to dive into. So you're here because you've either been diagnosed with GD or you have concerns that you could be, that with the diagnosis comes fears and questions for your baby, your birth, your own health. And just deep down, you feel like something isn't right about the whole thing. Why me? How is this happening? And you're looking for a bigger, deeper answer. So I could spend our whole 90 minutes together telling you what GD is and why it's a problem, why they want to induce you early, and why induction isn't evidence-based, the risks and myths of big babies, or I could teach you how to heal it naturally without diet or exercise. So in the guidebook, I am including lots of resources so you can dig into all of these other answers, but I'm going to give you my own special sauce of how I can help you overcome the gestational diabetes and have a healthy, uncomplicated pregnancy and birth. So I just threw this one in here. One of the resources is Dr. Sarah Wickham's resources. But they've basically found there's no evidence showing that induction of labor is beneficial for women with gestational diabetes, that the risks of induction that can often lead to C-sections outweigh the risk of letting you go to term. No induction, no colic guaranteed. And so my clients never need a medical induction. You guys are both ready and excited for birth, that you always go into labor spontaneously around the time of your due date, within plus or minus, the week that is typical. And babies are so heard, so seen, so connected that colic is impossible. That colic tends to be existential fear that they have and trauma. And the support BioTalk gives them makes that impossible. So my guarantee is that if you do go to 41 weeks, you get free sessions to get you into labor without a medical induction. And if you do need a medical induction that's been warranted, I will support you with that if it has to happen earlier. And the no colic is if your baby does have inconsolable crying, I will give free extra sessions to your baby until we get it resolved. And I had people I've met prenatally that has a baby with colic, and they come running to me, and with one session, typically max 2 sessions, we can resolve it. But I've never seen colic in a baby I've worked with prenatally. So on my website, there's this blog post here about Ivy's story. When Emily was pregnant with Ivy, she had the alloimmunizing problem where she created antibodies against the baby, and I thought the baby was going to need all these blood transfusions. And I worked with the baby in the womb, and we didn't have to do any prenatal transfusions. She needed one partial transfusion after birth. She was able to get the VBAC she desired despite being induced really early, and we were able to give her some really great birth outcomes despite a really difficult pregnancy and lots of challenges for her. BioTalk was really great support that she wrote out the whole story for me, and it can be found on my website. So I work with a different approach to healing. So you've experienced getting cut, and yet you do nothing, and your body heals itself. That we have this innate ability to heal. Your body knows what to do. We came from a sperm and an egg that came together to multiply, and it knew that this cell was a heart cell, and this cell was a bone cell, and this cell was a blood cell. We have this innate intelligence within our body that knows what to do to heal us. We have an amazing immune system. We have this orchestrated, system of body chemistry and metabolism and hormonal systems and endocrine systems that all dance together, that need to be in communication with each other. You have experienced smelling food. Oh, and then we're hungry. Seeing something beautiful and being brought to tears and crying in joy. Thinking about a future event and feeling anxious, or something that pissed you off and making you feel angry. You have experienced how the environment and thoughts create the physical responses in your body. It creates the biochemical. We know our brain and our body, our mind and our body, our emotions, our experiences are connected, that we cannot disconnect one from the other, that you get tense and your blood pressure goes up, you get afraid and your muscles tighten and tense up, that our body responds to our thoughts, to our emotions. And so that's what BioTalk is all about. So the top-down approach to healing is that we have our physical body at the center of ourselves. And anything we do at the physical level, massage therapy, medications, physiotherapy, anything that's working at manipulating the physical body heals at the physical level. But above our physical level, we have our energy body, the vital body. And in traditional Chinese medicine, it is known that your stress and your diseases and everything that is affecting you shows up first in your energy fields before it affects your physical body. And the traditional Chinese doctors were only paid if they kept you well. So working with acupuncture and chakra healing and all this, the processes of working with the energy systems, you can heal and prevent issues at the physical level. So BioTalk is an energy medicine. We do work with the energy systems, but it's so much more. We work with the mental body. So this is where cognitive behavior therapy and traditional therapies work, that our mind creates our realities. That if you are going down a mental spiral and it creates the stress within your body, it'll mess up your energy and it'll mess up your physical body. Whereas if you think gratitude is our greatest healer, if we can be in a place of gratitude and see that beautiful, loving thing and be in that energy of goodness, that energy works with our energy body and our physical body, and it actually helps our body to heal. And then we have our wisdom body, the supramental body. And this is where BioTalk works. These are our paradigms that we create, mental programmings that we've been programmed since we were small children to see the world. We have programs about money and about how families and relationships work. And some of these programs don't work very well for us. And this is working at the supramental body, above the mental body, the main programming levels of the body. And this is where BioTalk works, at this consciousness level. And as we heal at this level, the mental body heals, and all the worrying and thinking and the belief systems that we have, our energy body and our physical body all heal as well. And then the fifth layer is our bliss body, the Anandamaya Kosha, which is our level of spontaneous healing, that nothing has to be done. It is just spontaneous, and we don't need to work there. Your body has that. Those are our awakening moments. So gestational diabetes is disease. It's dis-ease, a lack of ease. It's a sign of dysfunction. It's a sign of stress, of worry, of fear, anxiety. It's communicating something to you from your deeper mind and soul levels. It's a sign of an imbalance within our mind-body. Our mind and our body are not separate, so we keep them as one word. And there's a bigger, deeper root cause it's trying to tell you. So we look at us like that iceberg. There's that 10% on the surface and 90% below the surface. So we have that conscious mind at the surface. Everything else is below. And once we bring things up to the conscious mind, BioTalk is consciousness-based healing, that all that is needed to heal is consciousness. That once we recognize, A, there is a problem, and B, what the problem is, then your innate ability to heal itself can go to work to heal. But if it's concealed and we're not even aware there's a problem, there's not much we can do. And so it's all about bringing things to conscious awareness, that once we know there's a problem, we can fix it, and helping your cells of your body to know. So consciousness-based medicine. So the state of being awake and aware of our surroundings. It's our perception of something by a person, but it's also the fact of the awareness of the mind of itself and the world. When you ask, who am I? You're aware that there's a part of you that says, yeah, who am I? That's asking the question. And there's a part of you that starts to think about an answer. And so it's this level of working at bringing things to that conscious awareness, for the mind to be aware of itself, of its bodies, of the world, how we fit into the world. Peace cannot be kept by force. It can only be achieved by understanding. We can't force peace. Peace comes from understanding. And once there's understanding of, oh, this is why this is going on. Oh, I can fix that. We can bring in harmony and peace into the body. And Einstein was a pretty smart guy. And that, as we talk about culture wars and all of our different things, if we can understand each other, we can understand our bodies, then we will be at peace. So body consciousness is the understanding that every part of us is communicating at all times. It's our process of how consciousness, thoughts, and emotions affect our physical structure, and vice versa. So we already talked about this a little bit, but the mind and the body mirror each other. If there's pain or tension in the body, you will also find pain or tension in the mind asking to be addressed. And what our mind suppresses, our body expresses. And so I'm absolutely in love with Dr. Gabor Mate's new book, The Myth of Normal, and how it's all about how our suppression of our emotions and speaking our truth and the different patterns we play in our life show up as physical problems in our body. And he's a medical doctor who is absolutely amazing. Recommend all his books. So it's getting a lot of research and attention now that the mind and the body do mirror each other. And here we're working with body psychology, which is the actual process of digging in to discover and to release what is being held in the body, the mind, the spirit that's no longer serving you. And that when we can listen to and address the underlying issues, it no longer has to yell at you and beg for you to have its attention. So I have a really cool story. When I did my yoga teacher training in South Korea, my second training in 2008, I developed a plantar wart. And everything I did, I couldn't get rid of it. When I came back to Canada and I opened my own little yoga studio and I was learning all these cool healing modalities, and I wanted to go back to Thailand where I studied after and take more yoga training, they started to spread. And 12 years later, I still had these plantar warts. I tried everything to get rid of them. And my body kept telling me I wasn't to teach yoga anymore, that every time I picked up a new class, I'd have a client wanting to book in, and it was becoming very, very clear I needed to be a body talker full time. And so I closed my little yoga studio, and the next day my warts disappeared. So when we look at the sole of our foot, it's about our soul. It's about our path and our journey in our life. And the soul was communicating to me that I was walking the wrong path. And as soon as I listened and took action, it didn't have to communicate to me anymore, and it disappeared. It's one of my favorite stories because it was 12 years and then gone overnight without doing anything except closing my yoga studio. And I still taught some other random classes for a little while after that, but that was the big step. So it may seem like your body's hurting you, but it's ultimately trying to help you. So just like those plantar warts I could not get rid of, they were trying to tell me a message that I needed to change the direction of my life, and I need to be doing this work for you guys full time. And I've been a full-time BiTalk practitioner. I still prescribe one-on-one, custom yoga programs and do some other interesting things. But since 2018, I closed the studio before Ben was born, my youngest. So I think 2015 or 16, I closed the studio, and I've been working full time since then. So experiencing symptoms is your body and your mind asking for you to help, to process your new experiences, any stresses that you have showing up in your life. It's helping you to be aware that you have fears of the future that you need to let go of, that you have old wounds and traumas and patterns that are no longer serving you, that you might be walking the wrong path, that you are carrying generational stuff that you no longer need, or you're carrying on reactivity or other patterns that you don't need anymore. And it could be just a way of evolving your consciousness, of waking you up. So we look at the 4 stages of consciousness. First being victim consciousness, life happens to me. Then we shift into manifestor consciousness, life happens by me, that you can change your reality by changing how you show up to the world, your thoughts, your feelings. And then we have vessel consciousness, that life happens through me, that I'm a vessel of God, universe, spirit. And the 4th stage is that enlightened state, that you are connected to it all. And so if we're stuck in victim consciousness, we're stuck in unhappiness. And the only way out of that is to shift out of victim consciousness. So there could be bigger, deeper things there. And Body Talk has taken me through so many layers of consciousness shifts. It's been profound. So when we look at diabetes, we're looking at the body psychology of the pancreas. And so mypocketpractitioner.com and the app, My Pocket Practitioner, is the app created by Amanda Miller, a Body Talk instructor. And she's created this amazing app that goes into the psychology of all of our different body parts and systems. So this is direct from the app. So the consciousness of the pancreas is related to its ability to regulate and balance blood sugars. Not only does it have to adapt to the changing situation in the blood, depending on what one is eating and drinking, but is responsible for how adaptable one is to things in life. So its main issues are inadaptability, rejection of receiving, love, joy, support, and overthinking. So these different pieces were supposed to come up one at a time, but no longer are. And if you want to type in the chat, me, when they really fit you, please do. These ones are a combination of things from Amanda's and a couple other books and what I've compiled for the book, The Pregnancy Symptoms Translator. So, struggling to adapt to being pregnant, birthing, or the idea of being a parent. Who's struggling there? New situations are difficult and uncomfortable. Liking routine and certainty, and really disliking the uncertainty of it all, and the uncertainty that, birth and babies bring. Being shy, which could be really the vulnerability of birth and the nudity and the intimacy of birth. Fear of fully participating in life or birth. Needing to re-examine who you are and what life is all about. I gotta type both there to fix. Well, this one works. And overthinking. Feeling like life is serious and has lost its sweetness. Feeling like life or pregnancy is hard to enjoy. Being stuck on the idea of what life should be like, what your pregnancy should be like, and focusing on shooting on yourself and not enjoying what is there or having gratitude for what is currently in front of you. Feeling like there's no sweetness left in life. Feeling stuck and trapped, stuck in your own world of limitation and lack. Feeling like you don't deserve to have your needs met. Longing to belong. Self-imposed social isolation. So if you have the opportunity to get out and connect with people, but you choose to stay home and watch TV, that's not enjoying the sweetness in life, and that could be showing up as your diabetes. Withdrawal from vulnerability and connection. Sugar and carbs as a love substitute, trying to feed how disconnected you feel. Self-disliked, feeling sorry for self, feeling starved for love, being self-made, going it alone and needing to be a martyr. So really trying to be utterly independent at the sake of your own needs. Not allowing yourself to receive help. Feeling like help is available creates more work for you. So the inability to delegate, or if you have a care provider that is making your life challenging and not giving you autonomy and control over your birth and your body and demanding things of you, that maybe you're feeling like they're more challenge than their help, right? Inability to delegate, deep need for attention and approval, being a human doing, not a human being. So having to do all the time and not allowing to just be and be present. Feeling unable to stand up for oneself. So also this can come into your care providers and getting the birth and the pregnancy that you would like for yourself. feeling like things are not in control, feeling like you are incapable. So, what is body talk? So, it's all about how we have this internal communication within our system, that every single one of our cells is in constant communication with each other. And when that communication is disrupted, this is where we have trouble. It's mind body medicine. And so, the picture I have here of the light bulb is how I think of us, that we're a light bulb, that we come into this world bright and shining, and life puts all of its layers of conditioning and dogma and experiences and trauma and beliefs and stuff so that we no longer know who we are at our core again, that we no longer shine, that we lose touch with our truth and our essence and what our purpose in life is and all of those different things, that we just get bogged down by it all. And so with Body Talk, we're trying to strip away all those layers so that you can shine again. Know who you are at your core. Know your truth. Be in touch with your intuition, in touch with your passion. So it's really a spiritual based process of finding yourself. We call it individuation, the state of not being divided and knowing your own self and truth. It's an effective stress reduction therapy. It helps to bring the body out of stress mode, move into the parasympathetic rest and digest mode. And so when you experience our session here tonight, or when you come and join me for a session virtually or in person, you will notice that your body may start to gurgle and growl because you're moving into that digest mode, and you're going to start to feel really relaxed and just start to feel much, much more at ease, that we're stripping away those layers and we're calming that nervous system down. It works to resolve the trauma, including generational trauma, that we're able to work back to those generational layers. And I've been able to work with actually healing genetic things. At one of the children in my case study with epilepsy, all the family members had epilepsy, the mother and the younger brother. And I was able to work back at a more deeper generational level for her epilepsy, get her seizures to stop. But what was the most amazing was her little brother's seizures stopped as well, and I never treated him because I healed it at that genetic and generational level for them. So this is really profound in what we can do to heal your babies in the womb and to keep you from passing anything generational down. I was working with a Jewish client, and her fears of having being assessed at work and her levels of value tied back to the generational Holocaust stuff, that we all have generational stuff that we carry. And in my book, I get into it a fair bit. We get to the root cause of the issue. So by digging around in our subconscious, it can take us back to an event when you were in the womb or 2 years old, or whatever experience it is that is communicating it to you. And once we understand the problem, then it can be healed. We can release the limiting beliefs and programming by working at those root causes. Oh, this is why I believe this? Oh, I don't need to operate that way anymore. And once we're aware of our programming, then we have the ability to change it. And so I come from 2 narcissist parents, and I've done a fair bit of work to not make everything about me. And it still shows up, and there's still more layers to it. But once we start to dig into it, we can really make some good progress. We can strip away the old stuck emotions and experiences. We work with some somatic experiencing, and we find the stuff that's in the body and we help it to release. And our stuff that's stuck in the body creates restrictions and will impede your posture and your baby's positioning. Even if you don't need a VBAC, come check out the VBAC class, because I really get in depth into fetal positioning and how our stuff is stuck in the body and how we can use that to make sure that fetal positioning is crucial for an effective birth. It creates better communication within your body, your mind, and with baby. That I talk to baby in the womb. I get into their subconscious. I know who they are. I find out what they're afraid of. If babies are overdue, it's because they're afraid of something. One of the most common ones is if they have older siblings, they're afraid of dethroning their siblings and how their siblings are going to feel. And they don't want to do that to their siblings. I've seen that one a number of times. So I really love working with the big siblings to help them to prepare too. But we can get both you and baby ready and excited for birth and really create a bond and know each other in a way that is so different. 100% of my clients say that it really helped them to know their babies, connect with their babies, and it makes parenting their babies so much easier when you have that intuitive connection and you know just what they need. And it helps you heal physical, mental, emotional, spiritual. Said I've helped kids heal epilepsy, and I'm working with neurological tics, and I've helped people with back pain and their depression. You name it. We can get to the root cause of it. And so your gestational diabetes is likely one of those things we already went through, trying to get its awareness to you so that you can work through those root things, and then it doesn't have to communicate to you anymore. One of my prenatal clients last year, her little guy is just about to turn 1 here soon, got off the treatment table at the end of her session and went, "Oh, by the way, I've been having very severe carpal tunnel. I can barely butter toast for the other kids." And I looked up what I had written out in the pregnancy symptoms translator for carpal tunnel and what it communicated. And we looked back at my session notes and I'm like, well, we covered this, we covered this, we covered this, we covered this. And we didn't actually address her wrists or her carpal tunnel at all. We just addressed the underlying things. And when I did the session, I didn't know carpal tunnel was a problem. But we covered all of the bases anyways, because her body told me exactly what it is we needed to work on. And I get a text message from her the next day. Yeah, I carpal tunneled, all resolved. Those wrists are, feeling awesome. So it really does work. It's whole healthcare. It's an integrative practice. So if you can see behind me, I have a protocol chart. On the bottom, we have other modalities. We can bring in our other tools. So I bring in the fetal positioning, spinning babies. I bring in my kinesiology skills. I bring into cognitive behavior skills. Every practitioner you see will work with you differently. And so you're always welcome to shop around and find the body talker that fits you best if it's not me. I just want everybody to know what body talk is and use it because it is so helpful. Just like finding the right doula, finding the right massage therapist, we all work differently, and you need to find the one that's the right fit for you. And that everything that we've got going on in your body is contributed to our current state of health. That everything has a unique system and history, and it influences us. We gotta look at the whole story. So we already said it addresses all of that. So it's left brain knowledge plus right brain intuition creates structured intuition. So we have this protocol chart all memorized. And so we're able to just kind of run up and down it, ask a series of yes/no questions to your subconscious and map out a little bit of a story of what is going on in there. What do you need to know to get the information it needs to heal yourself? And so I look at it like there's a check engine light on your car, that you have this symptom. Oh, you have GD. Okay, what's going on here? So we can plug in that reader onto your car and you can get the error code. Okay, GD. All right, so now what? It's like, okay, we know what the problem is. Now how do I fix this? And so you Google it, right? And you can find it's, you got to change out a fuse in your car, right? Okay, that's simple enough. I can go get a new fuse. I can change a fuse. And you Google it. You find the step-by-step instructions. You find an amazing YouTube video that shows you how to exactly, find exactly where it goes, change it out, lickety-split. You have fixed your car. So body talk is the same way. I am the translator. And it's basically that YouTube tutorial for your body. that it'll pull up the step-by-step instructions to your conscious awareness, and it'll tell us that you need to fix this. And we can get right down to the mitochondria of a specific cell if we need to. It'll get us right down to those details. So whatever information is needed will come up. And so you will experience that. But the more information we have, the easier it is to heal. And so if you think of making a cake and all you have is a list of ingredients and you don't have any measurements or instructions, it's going to be really hard to make something that actually works. And so if you have detailed measurements and you have detailed instructions, maybe there's a video tutorial, and it is very clear and very easy on how you make that cake, it's going to be really easy to do. And so it's the same thing for your body. So I'm just the translator, bringing all this information up so that your body, in its innate ability to heal itself, goes to work and heals. And once we figure out what it is we're addressing, we pull up those yes/no questions, we map it out, we tap it in. So this is my little guy. He was my free birth. He was so quick, so easy. I think his actual delivery was probably 20 minutes. This is me doing the cortices technique on him when he was little. He just turned 6. This picture's a little bit older. So we tap it in. We tap to the 3 brains: the head brain, the heart brain, the gut brain. So as we work with the head, it's to fix it. The brain lights up. We tap. It creates these spike waves, these solitons, these tsunami waves that tells the brain to wake up, go to action, to fix. And they've actually done MRIs and CT scans and mapped the brain doing this work. And if you just tap on your head with no intention, nothing really happens. But as you create what we call a formula, we've mapped out all this information and you tap it in, you can actually see the different areas of the brain light up to go to work to heal whatever it is we told it to heal. And so the head is fix it. We tap to the heart. Heart is save it. It's like every blood cell is an office memo. So it takes 2 minutes for your one blood cell to get through from the heart, down through the body, come back around to the heart again. And so it's like an office memo going through the body saying, hey, you know how we got this gestational diabetes and how it's actually just communication, over a lack of power or being inadaptable or whatever your particular story is. Yeah, we don't need that anymore. Let's let that go. And we get that awareness and communication through the body. And then we also, in the more recent years, added in tapping in the gut brain, which is our instinct, our intuition. It's really knowing it. It's working at encoding it at that knowingness level. And so, but if you think your head is telling you to go one way, your heart is telling you to do something else, and you're torn in 2 directions or 3 directions, you don't make very good progress, and you're going to feel pretty stuck. And if our head, heart, and gut brain are all on the same page, we can get places really easily if they're all in alignment. And so here's one of our self-care tools for you. It's the cortices technique. And it is balancing our brain. So we have the left and right hemispheres of the brain. And we have that corpus callosum that connects them, and how it needs to have that balancing of that rational, logical left brain, that emotional, creative right brain, and how we need them in the emotional brain. We have our limbic emotional brain. We have our reptilian brain. We have all these different regions of the brain. We need them to be working and doing their job. And so what we do is we create an electromagnetic field between our hand. If you think of that old magnet-doodle toy where you would pull the magnet across it and you move all the little magnet things to the surface, yeah, it's like we can actually energetically pull the energy to the surface, create that electromagnetic field, and we can create this activation of our brain. So it helps to bring the brain out of stress mode. It helps the body to go into that parasympathetic rest and digest and heal mode, so it can go in and heal itself. So this is a great tool to do on a daily basis, or even more than once a day. We use it in trauma situations. Whenever my kids get nosebleeds or something else comes on, first thing we do is we tap cortices for it. We get the body to calm down and to go to work to heal. And so when I'm at a birth, and if there is concerns about postpartum bleeding, right to work with cortices. And I had one client they were really concerned about, and they were trying to figure out her medications and all these different things. And I just kept tapping cortices on her. And by the time they tried to figure out the medication, the bleeding had stopped. So we were able to avoid some yucky medication that she really didn't want. So it's a really powerful tool. So it's really simple. You use your hand to bridge the left and right hemispheres of the brain. So we just fold it at the base of the skull. And we want to have our other hand open so that we're not just on one side, that we're getting both sides. Then we take a breath in and a breath out. And we tap the heart for a breath in. And the belly. So once we get our 3 breaths, we move our hand up from where it is, one more position higher. You don't need much of an overlap. And then we tap again. Head brain for a breath. Heart brain for a breath. Gut brain for a breath. And so just tapping anywhere near the navel, anywhere on your belly is fine. And then from there, we move to the next position on the top of our head. You can tap on top of your hand, in front of your hand, behind your hand. You can even tap without making contact with your head. It actually works just as fine too. So if you're working with someone and they're bleeding, you can, I do this on myself as a surrogate for people. And so I'll do cortices on me postpartum, so I don't actually have to interfere with the postpartum bonding, just to help facilitate the healing. So once you get through all 3 brains, we'll move around, and we want our last hand position to get right down to the eyebrows. So depending on your head size and your hand size, we may need one more position or less hand positions. And once you get through, then we do the limbic brain, that emotional monkey brain of ours, the chimp brain. And we hold that, and we take one hand off. Some people will just pull both hands off and tap and be done. I like to do both sides. And so it's a very simple technique. They've got research where they were doing this in schools to help with behavior and attention, and the data shows it does help. ByTalkSystem.com has all that data. I can share it with you if you want it. So I'm not going to spend too much time in this. I'm going to put this in the guidebook, but there's lots of benefits for the pregnant person. So dealing with all the physical stuff, resetting the nervous system, dealing with your limitations, healing all your wounds and your reactivity, your stress, addressing any pre-existing depression and mental health stuff so you don't have problems postpartum. It can really support birth and release the old holdings in the body so you can get a better positioning, address your fears with birth, address your own birth into the world, as you tend to want to replay your own birth into the world to heal it. If you haven't addressed your own birth, you're going to want to, and your own birth had some complications, you're going to want to look at that. Otherwise, you'll often end up replaying the same scenario as a way of trying to heal it for yourself. Good mindset, excitement for birth, shorter labors, reduced pain, ecstatic orgasmic births. We can rehearse the birth process and do a time release session that I do. I can get you going into labor if you're full term and improve your outcomes for early induction. I find early induction, usually we can't get you into spontaneous labor too early, that you and your body just aren't ready. And so it usually needs a little bit of medical induction. Emily, that I had the one there, they were able to get her going, I think with just the Foley bulbs and some of the non-medicinal things to get some good outcomes for her. So there's ways we can do it. So here is a little quote from APA in how our early experiences affect us and how our brains and our bodies, our nervous systems are being formed in the womb right now. And what goes on in the womb and through our birth processes affect us lifelong. And so that we know what happens during fertilization, embryonic, fetal, and neonatal stages, the genes and the environments, the nurture-nature controversy can cause neurodevelopmental delays like ADHD and anxiety and affect our development. And so we want to keep pregnancy a time of least stress and connection and awesomeness to enhance their development. And that's why we're able to really get easy, calm, content, bright babies with body talk. So this just shows how the fetal heart rate goes up with maternal heart rate and how they really get your stuff. And so I cover this one a little bit more in the VBAC class in how mother stress creates issues for the baby. So here's our benefits for the fetus. So we can really help optimize them, heal their genetic stuff, their generational and past life traumas, their fears and limiting beliefs, help them make sense of their world and their place in it. And this is really particular with the surrogates I've worked with. And like, who is this person? I'm disconnected from them. And it's their place in the world. Adoption creates so much trauma, allows them to communicate, helps with the bonding. And then they're ready to go when the time is right. We're able to get them. And how it helps the baby after birth, catch up on missed milestones, help with breastfeeding and bonding and attunement, and help their developmental leaps, everything. So I'm going to stick all of this stuff in the guidebook, and I don't want to spend any more time on it. But we can do sessions for the family to help everybody get connected together. We can work with the partner's fears around birth and their generational parenting patterns and their limitations. One of the favorite things is the dethronement of older siblings. They're going to have, behavior, sleep, and potty regressions typically is typically seen, and we can help with all of that. So what do we do to heal GD? We trust the innate wisdom of the body to heal itself. The healing is already within you. Just like I was able to lose those plantar warts in one day because I finally listened to what my body was telling me. Or my client with the carpal tunnel. We worked through all of the underlying factors that her wrists were trying to communicate to her. And then her wrist didn't have to hurt anymore. And I see this day in and day out. That consciousness is all that's needed to heal. Once we know and understand what's going on, your body takes it from there. It does what it needs to do. And you don't need to do anything. I don't do anything to you. I don't send energy in. This is not Reiki. It is just translating what's going on in your body. It is just getting the messages. And got some loudness going on. It's acknowledging that communication. And once it's received, it can stop yelling at you. And the more information we have, the easier it is to get to work. So we can get that step-by-step YouTube tutorial, and your body knows what to do. The roots can be complex or simple. So sometimes it's a single little dandelion root. One thing, we pull it out, it's resolved. But other things, like my complicated attachment from being an unwanted child, has broader breaching roots. It's like runners of grass, and there's little bits of pieces here and here and here to why and how it still impacts, right? And so we pull out pieces here and here and here and here, and eventually we'll get it all. But some things can take some time and a number of sessions. So some things can be quick and easy. I had one client, 18 years of back pain gone in one session, arthritis and knees gone in one session, and other things not so simple. Or we're just not listening or taking action to the communication. So basically, we heal GD by talking to your body and asking your subconscious for the answers. The answers are already there. And my computer's going to freeze. All right, so now it's time to experience a BITALK session. So you're going to want to get into a comfortable position. Lay down, sit back, find a place where you can just tune into your breath, to your body, and just feel and explore what happens in your body as we go through this work of asking your body its series of yes/no questions. And so, the first thing we ask is if there's any permissions. This is working at super conscious paradigm shifting levels. And permissions can take us in to wanting to the permission to do the session in the first place. And so sometimes it'll tell me that somebody or some other modality is better for you. And usually it'll just give us that information and then move on to the session. But sometimes it'll tell us that we need the ER. We should call an ambulance. Something is wrong. My youngest little guy in the picture, he ended up with one of those nurse elbow dislocations where it kind of pops out of playing. You're playing The Floor is Lava, and the babysitter's 7-year-old. This was right in the heart of COVID. Yeah, pulled him up by his arm, and when you pull and lift, there's a little ligament that can pop out of the way, and he had this little dislocation of his elbow. And body talk, refer. So, okay, this isn't something I can just body talk. We need some actual medical help here. And so we went in, they distracted him with the popsicle and popped it back into place, and good to go. And his body heals. He knows his body heals himself real quick. But if there's something wrong and it's out of my scope to heal it with body talk, it will tell me. All right, so we have no permissions today. Oh, things going on. Then we go in and check to see if there's an agenda for the session, our big theme, and then we check if we should just go into the protocol chart. And we're going to move into our sections 1, 2, 3, 4. Our 4th section, we get into our body chemistry, our active memory, our belief systems, our cellular repair, our circulation of the blood, the nerve, the lymph throughout the system, the lymph, and our bodygenics. And so bodygenics is about how it is the one I get yes to. So I'm just asking kind of yes/no questions here. If it goes through, it's a yes. If it doesn't, it's a no. And so I'm just asking these yes/no questions on me for all of you that are catching this recording or that is here with me live. So we're dealing with bodygenics, and this is about how our body processes our emotions and our experiences. We could talk about active memories. Is things active and triggering us and are we holding on to things? Or are they passive? Do we remember the experience and move on and let go? Go, oh, yeah, that happened. Or do we get riled up? Do we get emotional? Is it still active and charged? And so our bodygenics is the process of determining if that stuff stays active or not. Do we take the wisdom from it and move on and let go? Or do we hold it active? And our active stuff gets stored in our tissues. It gets stored in our body. And as a yoga teacher, I see people spontaneously start laughing or crying as we get into big, deep stretches, that we hold our stuff in our bodies. And it can get woken up in there. And so this is where we do some somatic work. But it also works with how the breath processes our emotions. And so bodygenics, more specifically to one of its pieces, no. Sometimes it can take us to clean out the diaphragm. The diaphragm is the storehouse of all of our emotions and our experiences. And sometimes it can get bunged up and backed up that we can't process any more stuff. And so sometimes we have to kind of energetically clear all the old stuff out of the diaphragm. If you think about it, when we breathe, we hold our breath if we're afraid. We can hold our breath if we're angry. If we get into that crying, we're not exhaling, we're not breathing. That's when our emotions and experiences get stuck. And so breathing deep, big, deep diaphragmatic breaths is processing our emotions. Take a big, deep breath. And this also takes us into our emotional release and actually finding a specific emotion or experience in the body and helping it come to the surface to be released. But we're working with just the whole process as a whole, no specific piece, no specific emotion, and its relationship to our environment. Well, actually, it's what we call the complex matrix, how we fit into the world and our place within the world. And all the masks, all the personas, all the ways we operate within the world. the complex matrix, your place within this world. And with that, it ties into this belief system, which is part of our active memories. Belief systems come up when we have a black, white, rigid way of seeing the world. You believe that iPhones are the best, and I believe that Androids are the best, and it causes a fight between us. Who's right? Who's wrong? You like what you like, I like what I like, but the beliefs are the problem, right? Not one of us is right or wrong. So these belief systems may not be that you're necessarily wrong or the belief is wrong. It's that you're just holding it too rigid and then you're not able. So it's about creating a space to let it move into the grayscale so that we can go, okay, maybe we can, come to some common ground. You can like what you like, I like what I like. Maybe having a smartphone's, pretty useful and not have a fight over it. So when we get triggered by our beliefs, it's a very polarizing concept right now, right? And there's usually not too many people in the clinic in the evening. It's getting out in the hall. All right. So the belief system that we're working with is it's coming up under the pelvis. It's about control. Pelvis, one of the things it represents is control. Not having enough control. It's about strength. It's this belief that I don't have the strength to take charge. You can feel that in the chest. Wow. I don't have the strength to take charge. So if you've got a health practitioner or a partner or a mother-in-law or someone that is telling you and giving you all their advice and putting all of their stuff on you, and you're just biting your tongue. You're not standing up for yourself. It's because there's this belief system that you don't have the strength to do it. I'm going to strip that away. I'm getting I feel energy, and I'm getting a really interesting energy sensation with that. And so this ties into another piece. It ties us into an event, lifetime period, through childhood, your childbirth, your own birth, or a past relationship. A specific event, time, person, place. Take the place, your place. It's about the power structure and your place within it. And so one of the things in our Western culture is that we believe, and we've put doctors up on a pedestal, that they know everything, that they're the end all and be all of the answers. Whereas your intuition, your inner trust, your inner knowingness, your ability to heal itself trumps all of that. And so we're working with this event of that power structure, the place within it, because I said so, the teacher being in charge, the parent being in charge, them being in charge, and the loss of autonomy over yourself. That feels so huge. And when we look at it, more deaths are caused by medical negligence, and properly prescribed pharmaceuticals in the way they're supposed to be than anything else, that you're safer avoiding Western medicine if you can, statistically. So we're going to tap that in. So now that we've mapped out the information we need, and just take a few easy breaths. We're going to tap that in. So we're focusing on that body genetics process, the processing of the emotions, the experiences, its relationship to how you fit into the world, the complex matrix, and its relationship to this belief that you don't have the strength to take charge, that you don't have that autonomy over yourself, and to the event of your experiences in your lifetime of being stuck in a power structure and having people, bosses, parents, teachers, doctors, knowing better than you about you. And there's a interesting other tapping process we can do with events, with any of our active memories. If you're familiar with EMDR and the rapid eye movements and desensitization of our memories and things, there is things we can do. We do circles, both directions. We do side to side. We do up to down to recode the brain with these active memories. But often we shortcut and not do the full process. And this one is not coming that we need the full process today. But if we're dealing with a really big, deep trauma and emotion, we'll do the full protocol. So from there, we have another piece. So we tapped it through the three brains with a few easy breaths. And you don't have to tap. I'm doing it here for you, but tapping is really nice if you would like to do it for yourself. So now it's taking us into other modalities, which is where we can bring in our other tools. Something from cognitive behavior therapy, something from kinesiology. So with my kinesiology degree, which is all anatomy, physiology, kinesiology is the study of our kinesthetic. It's our awareness of where our body is in space. And so it's taking us to kinesiology and how it relates to something. And when it comes into not wanting to do a specific, PNF stretching or range of motion work or any of the more hands-on manipulation things that tend to come up with the kinesiology protocol that I've created, it's usually wanting to highlight that awareness, that knowingness of self and its relationship to the complex matrix. Again, so it's wanting to highlight something about your place within the matrix. Are you alpha dog? Are you the wolf? Are you the sheep? How do you fit into the world? And each of you will have your own different answers for that. But this awareness of your place within it is crucial to the healing of your GD. And so this is where the body says no, the hidden costs of stress by Dr. Gabor-Mate, The Myth of Normal, his newest book, is amazing. The Body Keeps the Score by Bessel van der Kolk all goes into how we need to step into our power, step into our autonomy and take control. Say no when we need to say no. Say yes when we want to say yes without feeling guilty. And how this all relates into this belief system. I'm not allowed to shine. It's the word I'm getting. I'm not allowed to shine. So I don't know if you keep yourself small, if you hide behind things, if you are afraid of. So one of the concepts was being shy, right? Of not wanting to be vulnerable, not wanting to be visible, not wanting to be a thorn in someone's side and ask for what you want. That comes up as I'm not allowed to shine. And we'll have all that in. And that's all we're going to do. I got my thing to quit freezing. Oh, maybe I didn't. I'll move on to the next slide. And so, what was your experiences with that? How much of that resonated? What emotions, what experiences showed up in your body? This is all a process of feeling, connecting, and trusting with what's going on inside oneself. And so, as we wrap up tonight's class, I just wanted to share this little quote from Dr. Shafali that good parents are created through their dedication to becoming conscious of their own ego, their wounds, patterns that lead their instincts astray. So that's why my business is called Conscious Birth and Wellness. I help you heal, but it's conscious parenting. It's work at elevating our states of consciousness. It is clearing away and the things that no longer serve us. It's becoming conscious of our patterns and our wounds that interfere with our life, the triggers that when our children are triggering us, it's because there's an old wound they're putting salt in, and it's showing you that it's there to be healed. So you ready to unravel the stuff you no longer want to carry with you so you don't pass it on to your kids? Thoughts plus feelings equal your personal reality and eventually will become your personality. So whatever you feel and you think shape your reality. So this is basically laws of vibration, our universal laws, and quite well mapped out along with Heart Math Institute and Heart Coherence and what we create in our reality. That if you get up in the morning and you stub your toe and you're grumbling and miserable, then you spill your coffee on yourself and hit every red train, that those negative stuff will keep attracting the negative stuff to you. But if we can be in a place of gratitude, we can think good thoughts, feel good things, then our reality will mirror it. And if we do this often enough, it becomes our personality. But Gabor Mate, who I've spoken of, one of my most influential teachers, is much of what we call personality is not a fixed set of traits, only a coping mechanism a person acquired in childhood. So a lot of the ways we operate are just coping mechanisms. His book on ADHD is how it's a coping mechanism for how we take in life. And so nothing needs to be done, just receive. So we received our sessions. So what was your experience? Any questions? So those of you catching the recording, shoot me a message. Let me know what you thought. So what do we do to heal GD? So there's another one here. Act on the information provided if necessary. So my body kept communicating to me that I wasn't supposed to be teaching yoga anymore. I get hurt and I take on more classes. Things would happen. But it wasn't until I finally took action to close my studio that my planner's words went away. And so there's this 80-20 rule that 80% of it is at the conscious level and 20% is action. And so one of our examples for GD is you feel like your birth and things in your life is not in your control. And you feel that the help available to you, the doctor, is more of a hindrance and is taking your power away. That nocebo effect of the GD diagnosis creates even more stress and hopelessness. So what can you do? Well, we can do the by talk to get further support to connect with your inner empowerment. We can clear the limiting beliefs. And conditioning that underlies all of those patterns. You can get more education to make more informed decisions. And when they tell you something, you can go, I have information that what you're telling me is not evidence-based, that that's old information, right? You can take charge of your birth or hire someone who will help you. And so I'm taking extra training now in client advocacy. So I will be absolutely empowered to stand up and speak for you if you want me to, or to help you find your voice and speak for you, which is even better, or your partner. You can change your care providers. You can change your mindset and how the thoughts and the feelings create your reality. Other. There's so many different things we can do. But you can also act if it's needed. Your soul's purpose unravels when you trust yourself. So here's just a few of my package people. Rebecca, I worked with her all the way through her pregnancy. Her son turns 3, and I still work with them on a monthly basis, helping them through all their different struggles in life. She had some existing anxiety that we worked through, and then it showed up postpartum. We were able to help her get through that. And yeah, she was the one who the cortices got her bleedings to stop before she needed the meds. So, complete prenatal package is full of stuff. You get classes with me, infant sleep, birth prep sessions, postpartum sessions, options for virtual support, as well as in-person support if you're local. I have an all-in prenatal package that is the elite red carpet one where I actually come to you for your birth, and it gives you bi-weekly sessions, not just monthly sessions. So there's also that all-in package now as well, but that one is the gold star package. The complete package is the most typical one we have, and then there's also the birth basics package if you connect with me too late in pregnancy to do all the classes and you just want some birth prep and recovery, birth support, and all of these options are optional, and the pricing reflects that. If I'm on call for you, it costs you a whole lot more than if I'm just preparing you for your birth and helping you after your birth. So, and virtual support where I can be on call for you anywhere versus, being on call in our town. So prices all match that. Keo in Guam. I was working with her children, and her kids were, one was having trouble with school, and with working with him, I got him on the honor roll. The other son's eczema cleared up. We worked with his allergies. Her toddlers made a great transition to the newborn sibling. Her pregnancy went smoothly. And with the soul's journey, her VBAC, she'd had 2 previous VPACs. She'd had an induced stillbirth with an unviable pregnancy. 2 C-sections, 1 VBAC. And this baby came into the world telling me that he was here to give her the birth she wanted in life. But she wouldn't go into labor. She actually used my no induction guarantee. And as I checked in with her, she was having light contractions. She'd sleep and it would stall, and everything was okay. But then a lot of this work is knowing and trusting your body and your intuition, that you are in charge of your birth. And as we went through this work, we got things going, but her body said, no, you are not delivering this baby. And she felt some pain. She felt things were off. She trusted her intuition, went and got checked out, and they were finding that her uterus had thinned itself right out, and that she was actually, with having 2 C-sections, was actually at that rare risk of having a uterine rupture. And so she made the educated choice and she knew her body and what her body wanted of her. And so she got the C-section, and we talked to baby and we prepared him for the process, and he was able to go right to grandma because dad was home with the other siblings until mom was ready to take him. And we made it an easy process, and she recovered so quickly, so easily compared to her other C-sections. And he's the most easiest content baby compared to all of her babies. And yeah, Kay here, she had just lost her grandmother, so I helped her with her grief so she wouldn't carry that to her pregnancy, and helped her through that first pregnancy and postpartum. And she had an amazing experience as well. Megan was a free birth that we just did the birth package session kind of last minute when she found out that I was doing free births. So I was able to help her through her birth and clean up all the mess and help her out. And it was just a very easy, awesome experience. It was so powerful for her. Janelle was another one of my early packages. And so my special gift for you was when you signed up for this class in the first place, there was an option for an add-on to get a session for $100 instead of $40 for the 90-minute body talk session. And so if you book within 24 hours of this class, that you can get the session for just $100, either in person, virtual, or a recording like you're experiencing now if you're catching the recording. And my prenatal packages are all on sale until June 30th. 25% off the no support package, 30% off the virtual, and 35% off the in-person. I'm able to give bigger discounts off the bigger packages because there's a little bit more room and flexibility in them, as the no support package is already priced as low as it'll go for all the hours I spend working with you. And so learn more about it all at consciousbirth.ca. And feel free to book in for a free consult and chat with me, or just book an initial appointment and we experience a one-on-one session, and we just go from there and figure out which package is best for you. And the pricings are based off of, how far along you are and how long I'm working with you. And so we got all of that, and it's all there at consciousbirth.ca. It's still under construction in some places, so bear with it. All right. Wish you guys a really great evening. I hope you found that beneficial. I would love your feedback on the class. So thank you. I look forward to connecting with you soon.